My name is Ashley Mendes and I will be demonstrating 6 airway management skills in this video, and common errors for each. Dates of the production were 27th of September and the 4th of October.
The lateral side position involves placing the forearm away from the body, crossing the knee arm across the chest and bringing up the knee leg. Then rotate from the shoulder and the hip like so, placing the top leg up at a right angle to the body and the top arm away from the face. Gently rotate and extend the head like so to ensure free drainage of fluids. Common error is not placing this leg here, which causes the patient to roll into their face. I'm going to perform the triple airway manoeuvre and the sniffing position. So the sniffing position involves placing a small pillar underneath the head, and this straightens the airway. The triple airway manoeuvre involves 3 steps: the head tilt, chin lift and jaw thrust. So the head tilt involves placing your hand on the head of the patient and your thumb facing the nose. You want to then grip the chin between your thumb and your index finger and then gently pull back and lift the chin vertically. This helps lift the soft tissues and the tongue off the back of the throat and allows for a visual inspection. The jaw thrust involves putting your thumbs on the cheekbones and your hands around the mandible, and then you want to apply gentle pressure and protract the jaw vertically. This also allows the soft tissues on the tongue to be lifted off the back of the throat and helps with visual inspection and maintaining patency. A common error is to hyperextend the neck, which causes a kink in the neck and blocks the airway. So I'm now going to demonstrate how to insert an OPA. An OPA is used on an unconscious patient to displace the tongue and used as a bite block in ETT insertion. So it is contraindicated in patients that have a gag reflex or patients that have trismus. So a common error is to use the wrong sized OPA. So to fix this, we always measure from the corner of the mouth to the angle of the jaw, like so. We insert it facing upwards, halfway, then rotate it 180 degrees and bring it down to the lips. Now we want to check that the patient isn't gagging because the OPA doesn't protect against aspiration. We also want to look, listen and feel for breathing. I'm now going to demonstrate NPA insertion. So NPA is indicated in patients that are unconscious and that have trismus. It is contraindicated in patients that have middle third fractures or severe nasal trauma. A common error is selecting the wrong sized NPA. So I want to measure it from the nose down to the earlobe, and we want the circumference to be slightly smaller than the nostrils. It's also good to lubricate the distal end of the NPA with KY jelly before you insert it. So I'm just going to check before I insert that the nostrils are clear, and I'm going to pick the largest nostril. To insert, we want to place it at a right angle to the face and insert it straight down. We can rotate it clockwise and anti-clockwise a little to help insert it, but if there is any severe resistance, you need to stop. Once it is inserted, you want to check that there is no gag reflex, and you also want to look, listen and feel for breathing. So the next skill I'm going to demonstrate is a laryngoscopy. A laryngoscopy is used in an unconscious patient to check the upper airway for foreign body obstructions. We need to position the patient in a sniffing position, like so. We need to check that our laryngoscope is tight, white and bright, and we need to have our suction equipment on the right hand side. To begin, you need to place gentle pressure on the head of the patient using your right hand to tilt the head back, and then you want to insert the laryngoscope on the extreme right side of the patient's mouth and sweep the tongue across towards the left. We want to insert the laryngoscope into the valvular groove and then pull upwards and outwards to visualise the vocal cords. You need to make sure that there is no foreign obstruction in the airway. A common mistake is using an angling motion, which knocks the teeth and causes dental damage. I'll now demonstrate assisted positive pressure ventilation using a bag valve mask on an unconscious, non-breathing patient. First, you want to visually inspect the patient's airway by performing a triple airway manoeuvre, like so. We then want to use the correct size mask and get a good seal on the patient by rolling the mask over the top of the nose and mouth. To maintain the seal, we use a C grip using the thumb and index finger. We can place the rest of our fingers on the mandible and help to tilt the head back to maintain the sniffing position. We ventilate at 12 to 16 breaths per minute and visually watch to ensure rise and fall of the chest. Ventilations should be approximately 10 mils per kilo, so for this patient it's about 1/3 of this bag. I'll now demonstrate for 15 seconds how this is done. A common error is hyperventilating the patient.